Assalamualaikum warahmatullahi wabarakatuh and good day everyone. So today I'm going to demonstrate about the liver. Okay, just to make you aware, in our anatomy museum we have two liver models. Okay, two types of liver models. One is this one. We have lots of this one, and the other one is this one. Okay, but we only have two. And I think you need to learn these two together because for this model, it shows you a very clear ligaments. Okay, the ligaments are very clear compared to this model. Okay, so I'm showing you this one first. So in anatomical position, okay, liver should be like this. Okay, liver should be like this. This is the anatomical position, and it occupies the right hypochondrium. This region occupies the right hypochondrium, and then the epigastric region, and also a bit here at the left hypochondrium. And this is the diaphragmatic surface. Okay, so basically diaphragmatic surface of the liver covers the anterior part, the superior part, and a bit of the posterior part, which is at the bare area. So this is the diaphragmatic surface. When you look from the posterior inferior view, so this is the visceral surface. Okay, visceral surface means that it is in contact with the viscera. For the diaphragmatic surface, because why? It is in contact with the thoracic diaphragm. Okay, that's why it is convex and it follows the concavity of the thoracic diaphragm. Alright. So let's discuss about the visceral surface first. Okay. Unlike the diaphragmatic surface, which is smooth, the visceral surface is not smooth, and you can see lots of impressions, and also fissures. Okay, so in order for you to, you need to orientate yourself. Which part is the right part? Which one is the left part? Again, if you are confused, the biggest part is supposed to be at the right side, and the smaller part should be at the left side. So when you turn like this at the visceral surface, this is at the left part, this will be at the right part. I'm not talking about the lobes yet. Okay, just to make you orientate, what are the organs that are related to these impressions here. So this is an impression located at the left region. So this is supposed to be the stomach and also pyloric impression, okay, or area. You can also say area. So this one, it is in contact with the stomach and also the pylorus of the stomach. And another impression supposed to be here. So this is the esophageal impression, okay, and this is the area where it is not covered by the peritoneum, okay. This is the suprarenal area, which is in contact with the right suprarenal. And another impression a bit down to the suprarenal is the renal area, okay, where it is occupied by the right kidney. Okay, and this part here is the duodenum area, where it's occupied with the duodenum. Duodenum lies here. And then this is the colic area, where it is in contact with the right colic flexure and the terminal part of the transverse colon. That is the impression of the liver. Okay, let's talk about the ligaments. Okay, ligaments. Okay. Before the ligaments, I think I'll explain about the fissures first. Okay, as you can see here, there is a fissure, supposed to be a fissure here, although it looks like cord-like structure here. It's actually showing you the ligamentum teres of the liver. This is the ligamentum teres of the liver, which is the remnants of the umbilical vein. Meaning, in embryo, this was an umbilical vein, but after birth, it becomes obliterated and become a cord-like structure, and this is ligamentum teres of the liver. And by right, if you remove this one, you can see a fissure here. Okay, so this is one fissure. The second fissure is this one. Okay, so this fissure is fissure for ligamentum venosum. And ligamentum venosum is the remnant for ductus venosus. Okay, meaning in embryo is ductus venosus. At birth, this ductus venosus become obliterated and becomes the ligamentum venosum. Okay, and if you combine ligamentum venosum with ligamentum teres, the fissure for ligamentum venosum and ligamentum teres, it becomes the left sagittal fissures. If you do imaginary line here, so it becomes the left sagittal fissure. Okay, another impression here is the impression, the fossa for gallbladder. You can see that the gallbladder sits on the liver, okay, fossa for gallbladder. But this fossa for gallbladder, it is actually not lined by the peritoneum, because if you remove the gallbladder out, okay, you can see that the fossa for the gallbladder is not lined by peritoneum. And basically, if you look nearer, you can see that the peritoneum actually covers this surface of the gallbladder. So meaning the gallbladder is in direct contact with the liver tissue, and the peritoneum covers the surface of the gallbladder. Okay, so this is the fossa of gallbladder. And another impression is this impression here. This is the fissure for inferior vena cava. Again, this if you remove the inferior vena cava, this fissure here is not covered by the peritoneum. So if you do imaginary line connecting the fissure for inferior vena cava and fossa of the gallbladder, there will be another fissure. This fissure is called the right sagittal fissure. So this is the left sagittal fissure. This is the right sagittal fissure. So you can see another fissure here. This is the transverse fissure. Okay, this is a transverse fissure known as the porta hepatis. Porta hepatis. It is just like hilum of the spleen, hilum of the lung, hilum of the kidney, where you can find vessels and also bile duct entering and exiting from the porta hepatis. Okay. So the three structures that pass through the porta hepatis are the number one, hepatic artery proper. Number two is the portal vein, the hepatic portal vein, and this is the common hepatic duct. It's not the common bile duct, but it is the common hepatic duct. Alright, so I'm going to explain about the ligament using this model later, but before that, I just want to show you the area that is not covered by the peritoneum. So if you look at this model here from the diaphragmatic surface, you can see this area here. Okay, so this area is called the fissure for falciform ligament. So there will be two layers of falciform ligament. Okay, two layers of falciform ligament. They will attach here, and then from there they will attach to the anterior body wall. Okay, but the fissure here at the fissure for falciform ligament, this area here is not covered by the peritoneum. And then if you go back here, this is the bare area of the liver. Again, it is not covered by the peritoneum. This is still under diaphragmatic surface, and this is the area for suprarenal gland. It is also not covered by peritoneum. And at the porta hepatis also, it is not covered by the peritoneum. And I forgot to mention just now, the right sagittal fissure and the left sagittal fissure, okay, if you connect them two by drawing an imaginary line passing through the porta hepatis, you'll get an H-shaped structure. The H-shaped structure. What is the significance of knowing this? Is because the division of the liver. Liver can be the division into lobe. Liver can be divided into right and left lobes. But there are two ways of dividing the lobes. One is anatomical, the other one is functional. So for anatomical division, okay, the landmark is the left sagittal fissure, the one that connecting the fissure for ligamentum venosum with fissure for ligamentum teres. So these two, when you draw an imaginary line, you got this left sagittal fissure. So left sagittal fissure divide the liver into right lobe, right anatomical lobe, which is larger, and left anatomical lobe, which is smaller. This is when you look from visceral surface. But if you go anteriorly, the diaphragmatic surface, the landmark that we use to divide is the falciform ligament. Okay, so this is the fissure for falciform ligament. So the one that is located to the left, that is the left functional lobe, and this is the left anatomical lobe, and this is the right anatomical lobe. And what about the functional division? For functional subdivision, we use the right sagittal fissure that connects the IVC to gallbladder. Then you can see that the right functional lobe here is almost equal in size with the left functional lobe. So that is the functional subdivision. And for anatomical subdivision, there are another two smaller lobe. Okay. This is the caudate lobe. Okay, the one that is located beside the inferior vena cava is the caudate lobe. Okay, the one that is located beside the gallbladder, this is the quadrate lobe. So if you look at the anatomical subdivision, which is here, right? This is the landmark. The caudate and the quadrate lobe belongs to the right anatomical lobe. Right anatomical lobe. And another important thing that you must know is to describe the boundaries of the caudate lobe. And you look here, this is the caudate lobe. It is bounded by the inferior vena cava, fissure of ligamentum venosum, and also the porta hepatis. And if you look at the quadrate lobe, it is bounded by gallbladder, inferior border of the liver, fissure for ligamentum teres, and also the porta hepatis. Okay. But when you talk about functional subdivision, the landmark is here, right? So this is the right sagittal fissure. It looks here like this quadrate lobe belongs to the left lobe. And also the caudate lobe belongs to the left lobe. But only quadrate lobe actually belongs to the left lobe, but caudate lobe is an independent lobe. Because if we look back at the definition of functional lobe is when they have their own blood supply and biliary drainage. And for caudate lobe, it receives both from right and left branches. Okay. As you all know, left receive from left branches of these three structures, and right also receive from right branches of these three structures. But caudate lobe a bit special because it receives from both. That's why it is an individual lobe. I think that's all for this model. But let's have a look at the ligaments. Okay, this model is better if you want to learn about the ligament. Okay, it shows you a clearer picture on the ligament, which I think you can learn the other structures later on your own. But let's have a look at the ligament. So at the diaphragmatic surface, you can see this is the falciform ligament. It's actually double layer. Even you can retract it, and you can see the fissure in the middle, which is not lined by the peritoneum. And then this falciform ligament, okay, it runs here as upper coronary ligament. This is upper coronary ligament, also known as anterior coronary ligament or anterior layer of coronary ligament. Okay. And this upper coronary ligament, okay, it will mix with the lower coronary ligament to form the right triangular ligament on the right side, and also left triangular ligament on the left side. Okay, so this is upper, this is lower, this is triangular ligament. This is upper, this is lower, and this is the right triangular ligament. This is the left triangular ligament. This one. And then you trace back downward, you can see that this coronary ligament, okay, this is the lower coronary ligament. This is also the lower coronary ligament. Okay, lower coronary ligament. So when you reach at the fissure of the ligamentum venosum, this ligament is known as the lesser omentum. Okay, lesser omentum. But it has special name. Okay, lesser omentum has two parts, which is gastroduodenal and hepatoduodenal and hepatogastric ligament. So the one that at the edge of the ligamentum venosum is the hepatogastric ligament. Hepatogastric ligament, meaning that from here it is attached to the stomach. I know you cannot see the stomach here, but just imagine that from here it goes to the stomach and attached to the lesser curvature of the stomach. Okay, and then this gastrohepatic ligament, it continues with the ligament that at the edge of porta hepatis, and this ligament is still known as lesser omentum, but this part of lesser omentum is known as gastroduodenal ligament. So you can imagine that it covers these three structure. Okay, it envelopes these three structure. Okay, and attached to the first part of the duodenum. So from here it goes to the first part of the duodenum. Okay, but inside the ligament there are these three structures. And this is the ligamentum teres of the liver, and it runs together with the para-umbilical vein. Okay, I think that's all for the demonstration of the liver. All the best. Thank you.